So menopause means it's a permanent absence of menstrual period due to loss of ovarian function. We call it menopause when there is no period for more than 12 months. Of course, there are many other conditions which presents with no period for 12 months. We need to really roll out other hormone things. But then generally, when we call menopause, there should not be any period for at least 12 months. An average age of onset of menopause is around 51 years worldwide. And but before this menopause happens, there are many years a woman undergo hormonal fluctuations with irregular periods and with many symptoms of menopause. This phase is called perimenopause. So they may get period once in few months, sometimes heavy periods, etc., can happen few years before the start of menopause itself. That phase is called perimenopause. So again, perimenopause starts in the mid to late 40s when the periods become irregular, symptoms begin. I must also tell you that the role of endocrinologists, basically in India, we know that women basically go always to gynecologists for treatment of menopause and menopausal disorders. But actually abroad, endocrinologists plays a vital role because we deal with hormones and we deal with the nitty-gritties of hormonal treatment in menopause. And then, of course, we do that in combination with gynecologists mostly. But in India, unfortunately, people go directly to gynecologists always. Right. So in perimenopause itself, the symptom starts. And think of menopause not as a single event, but as a journey with the different phases. And some women experience symptoms for just few years, but many others experience it for over a decade. I have a question to you. How many years does the average woman spend after menopause? A, B, C. A is 10 years, B 20 years, and C 30 to 40 years. So the fact is that now nearly 1/3 of a woman's life is spent in menopause. That means that around 30 to 40 years of life they spend in menopause. That's 1/3 of their life. A 100 years ago, many women did not live very long after menopause, but nowadays it's not like that. People are living until 80, 90 years of age. That means that if they have menopause at 50 years of age, they have around 30 to 40 years to live after that. So with increased life expectancy, a woman may spend around 30 to 40 years after menopause. That means it is not the end of life. It's the beginning of an entirely new stage. Many women, when they enter menopause, that's the time when they get financial stability. That's the time when they have less responsibility because their kids are left and then they are actually quite independent. And when the menopause hits, and if you don't have a good life, means your 30 to 40 years of life is not in good quality of life. But that is the importance of dealing the menopause properly. So the focus should therefore shift from simply surviving to thriving after the menopause. So again, why does menopause happen? So you know that women, when they're born, before the birth, there are around 6 to 7 million eggs in both ovaries. At birth, it comes down to around 1 to 2 million. So when they start to have a reproductive life, only around 400 to 500 eggs are actually ovulated. So remaining eggs gradually disappear. And once the eggs are exhausted from the ovaries can no longer produce enough estrogen and progesterone. And when they go for menopause. So if I give you this complicated graph, you can see, look at the initial phase. Basically, you can see the menstrual period is divided into different phases. The first day 1 to day 7 basically is the time when somebody is having period, and then you have a follicular phase, then you have the actual ovulation happening, then the post ovulation, and you can see the hormones are fluctuating in these phases. And if a woman does not become pregnant, then periods happen. And what is period? Period is nothing but it's preparation of pregnancy. With each cycle, body prepares for pregnancy. So there is a lot of blood vessels, new blood vessels form in the uterus. The uterus lining becomes thick. So if the pregnancy doesn't happen, all these lining blood vessels shed and pass. This is called as periods. So many people think that, oh, if you don't have period for 3-4 months, I feel basically heavy and all. No, that won't happen. You may feel heavy because of hormonal fluctuations, but lack of period itself will not make you heavier. Right. So you can see this one is after the menopause. After the age of 50, you can see this is straight line. This fluctuation doesn't happen. This hormones FSH and LH remains very high, and the hormones estrogen and progesterone remains very low. This is how it happens after the menopause. The common symptoms of menopause includes hot flushes, which is one of the dramatic presentation many women come to us with, night sweats, disturbed sleep, mood swings, brain fog, which is no clarity, joint pains, weight gain, the muscles are gone and the fats are accumulating, and low sex drive or low interest in sex, and then vaginal dryness, urinary symptoms. I'll be talking about that in detail later on. And this is a busy slide, but you look at 1, 2, 3, 4 like that. So number one, what are hot flushes? They are nothing but the feeling of intense heat, often present above the waist, the face, neck, and the chest. And it may come with a small period of sweating and then redness. So it may last only for a few seconds to a few minutes, but it can happen multiple times in a day. Sometimes it happens in the night also. It's very, very, very disturbing for some women. Some women may not have this at all, but many others do go through this phase, and it's very disturbing and emotionally not very good. So the common symptoms, if you look at the number 3, you can see sudden heat, sweating, flushing, heartbeat going fast, palpitation, and then disturbed sleeps, feeling cold. After sweating, they feel cold. Irritability.
या जरा ऐकाय तुम्ही पण तुम्हाला पण कळेल.
Yeah, so what can trigger this menopause? Hot drinks like coffee, tea, etc., spicy food, alcohol, caffeine, these can exacerbate. So somebody who is already undergoing menopause symptoms, these things can make it worse. Emotional stress, warm room, heavy clothing, etc., etc. So mood changes is very important, actually. This is a very, very striking feature of menopause. Again, not everybody goes through this. It is present in many, not present in many others. Some women notice the change in mood. They become very irritable, actually very difficult to handle. It will cause problems in the house, with the children, husband, and in the workplace as well. This is again because of the hormonal fluctuations. And common symptoms include irritability, low mood, easily they cry, and anxiety for small things, feeling restless, mood swings, again poor sleep, low energy, poor concentration, etc. Treatment I will be dealing later on. Again, regular exercise can help, but I will be talking about that later on. Very important thing, apart from mood swings and hot flushes and joint pains, etc., etc., this is something else I need to really talk a little bit detail. Osteoporosis. You can see that many of our grandmothers, when they become a little older, suddenly the height is becoming lesser. You can see that they were very tall before, but then, when they are in their 70s, 80s, suddenly the height is becoming less. And why is the height becoming less? The height is becoming less because of the spine is becoming, more slopey, number one. Number two, second, the spine, there can be fractures. If there is osteoporosis, many of these fractures can be silent. In India, particularly, when we are going in an auto rickshaw, in a bike, in a car, there are multiple humps, potholes. Sometimes a fall in the potholes or a hump itself can cause these vertebral fractures. And many of these people will come with, they become short because the vertebra undergoes fractures and the overall height of the individual becomes less. It's not only for the height. Osteoporosis is a very important cause of fractures. You know that elderly people, many of them become bedridden after they have a fracture of the hip joint, and osteoporosis is a very common cause of that. Again, many people think that this starts after the menopause. Not really, actually. In India, once upon a time, the nutrition for women was not very good, and people used to become pregnant multiple times and breastfeed multiple children. So they are actually losing the bone structure. And again, one must understand that most of the bones are formed during the period between around puberty. It means from the time they are getting periods first time until around 30 to 33 years of age, the bone is forming. After that, bone doesn't form. Only daily maintenance with calcium happens. Calcium phosphorus, daily maintenance happens. But the bone is actually formed between around 10, 12 years until around 33 years. And that is a precious few years of life where you should be encouraging your children to take adequate sunlight, to get enough vitamin D, adequate calcium in the diet, exercise. So those things will help the bone to become thicker. That is precious time until around 33 years of age. Because whatever bone, good form bone they are forming during that age will help later on. So it's not that you start taking calcium after you become menopause. You have to give the children enough food with adequate calcium and vitamin D during this bone forming years until 33 years of age. This is very important. Let the children play under the sun during the weekends. Basically, let them get enough sunlight. So again, another important thing I must tell from a doctor's point of view is sarcopenia. Now, what is sarcopenia? Sarcopenia is nothing but age-related muscle loss. So women, after, not only women, men also, that after the age of 40, 45, you start losing muscle, around 1 to 2% of muscle per year. Women lose more muscle than men because at least in men, there is the male hormone testosterone is protecting them. In women, after the menopause, they start losing muscles much faster. And you have to really understand that. Today also I was talking to my gym trainer that when he was coming from the parking to the gym, he saw many white women. Today is Sunday, right? And many white women living here. They're active. They're swimming. They're going to gym. But they can see, unfortunately, people from our part of the world in 40, 45 years of age, they already have limping and they are very obese. They're not very active. Unfortunately, majority of our Indian women become less active after the menopause, basically because they lose muscle strength, they lose bone strength, they lose balance, they lose stability, flexibility. Again, common signs are weakness, reduced grip strength, slower walking, difficulty climbing stairs, trouble getting up from chair, and feeling less steady, and loss of muscle tone. We need to understand that this is preventable and reversible if we take adequate measures. And low protein intake is very common in India. Our food is mainly high in carbohydrate and very, very low quality protein. Even if at all we take protein, we take very less, very small amount. That is not enough to maintain the muscle. If you don't give protein to the body will take protein from the muscle. And another thing, women always come to me is basically with hair fall. A lot of hair fall, doctor. Check my thyroid. Thyroid is one of the many conditions which can cause hair fall. You have to understand that your nails and hair is made of keratin. So if you don't have enough protein in your diet, you will have hair fall. So adequate protein intake, adequate iron intake, adequate calcium intake, adequate vitamin D, they're all important for the hair and nails. So what can help with the muscle loss? If you do regular strength training or resistance training in India, unfortunately, we feel exercise means just walking. People walk a lot. Walking alone cannot be considered as exercise. So at least 3 days a week, you have to do resistance training. So I'm very happy that our yoga teachers are including resistance training in their yoga bit at least 3 days a week. You don't have to do resistance training every day. You have to do at least 3 days a week. So you have to have, if you exercise a muscle, you have to give at least 1 day gap for the muscle to recover. So if you do Monday, then you can do Wednesday, then you can do Friday. 1 day gap in between. That is what you do, resistance training or strength training. This is extremely important. And don't exert yourself and don't cause injury. Right? Know your limits and start slow and slowly gain the speed. And adequate protein. And how much we say adequate protein? Adequate protein for a woman is anywhere between 0.8 gram to 1 gram per kilogram per day. That means that a 50 kilogram woman should take anywhere between 45 to 60 gram of protein per day in 3 divided meals. So you need to understand that if you eat egg one egg is around, full egg is around 6 gram protein. Okay. So if you take 50 gram of soya chunk, 50 gram of uncooked soya chunk, if you cook, it gives you almost like around 20 to 25 gram of protein. If you eat around 120 gram of fish without the gravy, just the fish, it gives you 30 gram of clean protein. If you eat a chicken breast, around 150 gram, it gives you almost 30 to 35 gram of protein. If you eat moong dal, around 100 gram of uncooked moong dal, gives you around 30 gram of protein. But of course, you cannot eat that much after cooking. It is a large volume. Paneer, tofu, right? Beans, many pulses, they all have protein. And we think that our dahi has protein, but very less. There is something called Greek yogurt, which is a different form of dahi. Greek yogurt has the higher amount of protein, right? So we have protein from chicken, we have protein from eggs, we have protein from pulses, kalu, belu, all these things. And then you have protein from tofu, paneer, and many other things. And one fruit which has some protein is guava. Guava has some protein, but many other fruits, they don't have protein. Guava has some protein. Okay. So basically, to prevent the muscle loss, you need to have stay fit and active, adequate. And again, you need to understand vitamin D is not only for bones. Muscle strength also is dependent on vitamin D. So you need adequate vitamin D for the adequate magnesium, adequate vitamin D for the muscle also. And if you don't have adequate vitamin D, if you start doing exercise, you'll start getting muscle cramps and muscle pain. So make sure that your vitamin D level is above 30 nanogram. Okay, so that you may not get in India from sunlight alone. Many women, most of us may need some supplements, but of course, you have to go talk to your doctor to see how much you need. And one other thing I had to tell you that many people think that morning sun or evening sun is best for vitamin D. Actually, that is not true. Morning sun and evening sun is good for your mental health. But if you want to get adequate vitamin D, you need to expose yourself to sunlight between 9 to 4. In Indian subcontinent, that is the time when the sun has enough ultraviolet rays to convert your cholesterol into vitamin D. So because our skin is little darker, melanin will reflect the sunlight. So we need longer duration of exposure to get adequate vitamin D compared to Western people. So if you stay at least 15 to 20 minutes, get some sunlight exposure without using sunscreen, at least in your hands or legs, 3 to 4 days a week, that actually gives you enough sunlight, enough vitamin D. So you have to correct yourself. It is not the morning and evening sun which gives you vitamin D. It is the sun between 9 to 4. Of course, it is a little bit hotter sun. You don't have to get sunlight to your face, hands and legs without clothes. And of course, one other thing which I had to tell you is that balancing exercises, stability exercise and balancing exercise also is very important, which of course, most of you will be doing when you're doing yoga. So again, this is a plate, diet plate. You can see that this diet plate is divided into 3 parts. Actually, this is a healthy diet plate. 50% of your plate should be vegetables, non-starchy vegetables. Okay, we don't consider aloo and potato as a vegetable. Potato is a carbohydrate. So don't put that. Basically, 50% of your plate should be vegetables. 1/4 of your plate should be carbohydrate. Carbohydrate means complex carbohydrate. This is where you put your aloo or your rice, your parota, or chapati, whatever you put in this 1/4 of the plate. And 1/4 of the plate should be having protein. This is how a plate should look like, something like this. You see half the plate is, this is not aloo, this is gobi. Basically, you can see half the plate is vegetable and 1/4 of the plate has protein and 1/4 of the plate has carbohydrate. In many parts of India, we do have the habit of eating chapati and then again rice. That is, you are giving double quantity of carbohydrate. Whatever, you have to limit yourself within this 1/4 plate, right? This is very important. Okay, can I continue?
Yes, doctor.
Okay.
Continue.
Yeah, so many people think that, doctor, so in this part, I'm actually giving a vegetarian option, but of course, this part, the top part of the protein, you can be chicken, you can put tofu, you can put paneer, you can put a mixture of vegetarian and non-vegetarian, that pulses, and you can put some, moong dal and or soya bean or whatever, and maybe some fish, chicken, etc. So make sure that when I'm talking about protein, I'm not talking about gravy. Most people, they take two small pieces of chicken and they put a lot of gravy, and the gravy is full of things which makes you gain weight. So many people think that, doctor, I'm eating very less, but I'm still gaining weight. Gravy contributes to weight gain, especially the coconut gravy. Rich coconut gravy is very high in very high in calorie, right? So when you are eating, you need to make sure that the weight of the meat or the fish should be around 100 to 120 gram without gravy. That means you are getting roughly around 30 gram of protein. Okay, so many people think that, doctor, I cannot eat this much of protein in my diet. Can I take protein powder? Yes, you can take protein powder. Again, in India, many people think protein powder means the D protein or B protein, but they do have very less amount of protein, right? So protein powder, yes, you can take. If you think that you are not able to take adequate protein in your diet, definitely you can take protein powder. And what is a good protein powder? Whey protein. Whey protein is derived from milk. When milk is converted into dahi or curd or whatever, the water which is remaining on the top, that is whey, that is full of protein. Usually we throw it away. So in industry, they isolate protein from that. That is called whey isolate protein. It's a good quality protein. And again, when you buy this protein powder, don't buy whey concentrate. Buy whey isolate, 100% whey isolate protein, because whey isolate protein undergoes multiple cycles of ultra filtration. They remove all the heavy metals and all these things, and it is pure protein. It can be little expensive, but then it's worth it. So a scoop, one scoop will easily give you around 25 to 30 gram of protein. Many a times, this is my breakfast. I take a scoop of protein powder with chia seeds and a little bit of flax seeds, chia seeds, and a spoon of oats. I soak overnight and keep in the fridge. Next day morning, I add a protein powder to that and shake well and drink it. I'll have one small fruit as my carbohydrate. That is my breakfast most of the days, and that is enough. That gives you around 25 to 30 gram of protein, which will give you enough fullness until noon. But if you take very less protein and take a lot of carbohydrate, by around 11 o'clock, you will feel hungry again. So limit the carbohydrate, increase the protein, take at least 30 gram of protein so that you will feel full until noon. And never start your day with large amount of carbohydrate, because you are spiking your insulin level. And insulin is a hormone. If you have too much insulin in the body, that it makes you gain weight, because insulin is a weight promoting hormone. And again, insulin makes you hungry. So coming to exercise, again, I told you that earlier I was talking about what type of exercise is beneficial for the muscle. You need to do weight-bearing exercises. In this picture, you can see that the woman is climbing stairs. Climbing stairs is one of the simplest form of weight-bearing exercise. Then squats, different kinds of squats. Different kind of squats, basically we aim at different muscles. So these squats are very simple. Initially, you can start with body weight squat. Later on, you can do weight with small amount of weight as you become more stronger. And you don't have to do it every day. You can do around 10 repeats, 10 in one sitting, give a gap, again do another one, give a gap, again do. So 3 sets at least. 3 sets every 2 days, not every day. So I told you earlier, again, every day, same group of muscles exercising is not good. You have to give at least a day in between. So again, you can do simple push-ups. If you cannot do the full push-ups, you can do push-ups using a chair or a firm desk. Make sure that wherever you are putting a pressure, that should be very firm desk. Otherwise, it will slip away, and then many people will fall and have fracture and etc. etc. So you can do this kind of push-ups or full push-ups. Use dumbbells, etc. And I'm not going in detail about these kind of exercises. Your yoga teachers will tell you about this. And of course, if you are able to go to gym, very well. That is excellent, at least 3 days a week. I always recommend to go with a trainer initially. And again, unfortunately, the place where I'm living in Dubai, in the gym, is there in most buildings. Unfortunately, most of these buildings, our Indian people hardly come. Mostly it's Western and Arab people come. Indian people hardly come, but I have seen these days they are coming, but very less. But that should change. Gym is not for bodybuilders. Gym is for everybody. And one other important thing is that recurrent urinary infection, which is quite common after menopause. And why women get recurrent urinary infection, repeated urinary infection. Number one is because women have a smaller urethra compared to male. And you need to understand that the vaginal opening and the anus opening is in a straight line, right? So in between the vagina and the anus, that entire area, perineum, our colonic bacteria in your intestine live there. They are colonizing that area. Okay, so the E. coli bacteria lives there. And when women wash after passing stools, many women do the mistake of bringing from back to front. So you are actually introducing the bacteria from back to the front. You should not wash like that. First of all, you can use the health wash and always wash from front to back. Never introduce your stool to the vaginal area, number one. Number two, after the menopause, because the pelvic floor is not very strong, many women cannot completely empty the bladder. Some amount of blood, urine is always left behind. This can also cause infection because of the repeated pregnancies, repeated deliveries. The pelvic floor becomes very loose and the muscles in the pelvic floor becomes very weak. And so they cannot completely empty the bladder. That's another risk factor for developing multiple infections. One other thing is that the vagina loses the moisture, natural pH, is a slightly acidic pH, and natural lubrication after the menopause because of the lack of hormones. So the inside the vaginal wall, there it becomes thin, and bacteria can easily enter. So multiple reasons. And many women do hold the bladder for a very long time. Especially when they are in travel, office, etc., which is again another risk factor for developing urinary infection. So common symptoms are burning sensation. I'm not going detail into that. All of you know how urinary infection feels like, and how can we prevent it? Drinking enough water and passing urine whenever you feel like passing urine, and don't hold the urine for a long time, and always wipe or clean from front to back, not from back to front. Don't introduce bacteria from back to the front. And after having sexual intercourse, pass urine immediately and wash and keep it clean. Treat constipation, because if you have a loaded colon, you are not passing urine, that will prevent, because the bowel is sitting just behind the urinary bladder. If there is a lot of hard stool, it will prevent the urine to completely empty. And of course, if somebody has diabetes and many other conditions, the urinary infection can come again and again. This is something which many women live with. You all have to talk to their doctor about this. There is nothing to shy about. And this is another common problem many women, after menopause, many women do develop because of pelvic muscle again becoming weak, or they cough, they sneeze, they talk sometimes louder, they laugh, some amount of urine leaks. Okay, so this is stress incontinence, and this is many people will not even go for social functions because of this, because of the stress incontinence. This again is treatable these days, easily treatable, and you can meet these days. There is aesthetic gynecologists and also urologists who can easily treat this. And sexual issues, many a times women do not actually discuss this. And you are having menopause at 45 to 50. That doesn't mean that your life is ended there and your partner is leaving. And then of course, sexual intimacy is very important for life. And you don't have to live without sex after menopause. That is very important. And then you need to discuss this. If you have a problem, you have to always discuss with your doctor. And always, one mistake I see Indian women, they always come with their children. It's best to come with their partner or come alone so that you can discuss that in open. And how do you manage sexual problems? One is vaginal moistures. Because of lack of moisturization, people have pain and etc. They avoid sex. So you can use water-based lubricants. Sometimes we use vaginal estrogen 2 to 3 times a week. That also helps to prevent recurrent urinary infection and also for the sexual function. Pelvic floor exercises, very important. In yoga, we have this Sedu Bandhasanam and things like that, which is pelvic floor exercises, which helps basically for strengthening your pelvic floor, which again helps. Counseling and communication is important. You don't have to shy. If you are shy to talk to a doctor, you can talk to a counselor or a nurse, and the nurse can communicate to us. So Kegel exercises is something which I need to talk, and many times during my yoga sessions, I was very happy to see our yoga teachers instructing this to the participants to do this while performing yoga. And how do you do that? When you sit, or you can do sitting, lying down, standing, or on in the table position. What you should do is that you should imagine that there is a piece of paper sitting in between your buttocks. Think that you're keeping a piece of paper in between your buttocks and you are squeezing the paper. Hold it for some time, leave it. Again, squeeze, hold it for some time, squeeze it. So basically, you are actually exercising your pelvic floor muscles, right? Again, when you pass the urine, hold the urine. Again, pass, hold the urine. When you're doing that multiple times, you're actually strengthening your pelvic floor. Another thing what we do is this Kegel exercise is basically the Sedvandhasanam. You see that you are doing it and hold it. And again, multiple times. You do it a few times a week. This also helps to strengthen your pelvic floor. And having a good pelvic floor is important to prevent vaginal infections, urinary infections, and for having a good sexual health. And when do you seek medical help in menopause? When you have heavy bleeding in the premenopausal time. Don't think that I'm having menopause or I'm going to have menopause, my bleeding is because of that. It could be because of any other hormone condition. It could be another medical condition. So don't think that, don't self-pay. If you have heavy bleeding anytime in your life, you should always go and meet doctor, right? Sometimes it could be a polyp, it could be many other things which we can catch early and treat it and completely cure it. The problem is delaying the treatment. Many a times women shy away and they don't go and see the doctor early. If you have early menopause, if you have menopause, if you have no period before the age of 40, 45, then you should always go and see a doctor. It need not be menopause, it could be another hormone condition. And if you have post after the menopause, if you have bleeding, always go and see a doctor. And unfortunately in India, nobody go to gynecologists regularly. We go to gynecologists only if you have a problem. That is not true. What you should do is that it's a good habit to go and meet a gynecologist at least once in 6 months to 1 year. Basically, because for preventive checkup. Again, in India, one other thing what we do is that we don't go to dentist unless we have toothache. That is bad. We should go to dentist every 6 months to 1 year for a regular checkup, for cleaning, etc., preventive checkup. Similarly, women should go to a gynecologist once in 6 months to 1 year for examination and advice. You may need mammogram and many other things. Or if you have unusual hot flushes, it could be also because of some other hormone problem. And bone density. I told you about osteoporosis, the bones becoming weak. And there is something else which, unfortunately, in women in India don't do it. In Western countries, it's part of the regular checkup. So we recommend doing a bone density screening. There's a simple machine called DEXA scan. Most places in Bangalore and India, where you have a endocrinologist, they do have this DEXA machine. It's a very simple machine, very low radiation, much less than taking an X-ray, and it takes only around 5 to 10 minutes. And normally we do the scan after the age of 65, every few years. Okay, but we may do the scan earlier than 65 if there are some other risk factors. Suppose a woman who was a heavy smoker or alcoholic, or family history of early fractures, or a personal history of fracture, or the person was using steroid for a very long time, or many other medications, or history of rheumatoid arthritis, and many other hormone conditions. In those women, we may do this bone density scan a little bit more earlier. Another thing I have to tell, when we talk about calcium, people always think about milk. No, milk is not the only source of calcium. Calcium is there in plenty in pulses, it is there in sesame, it is there in paneer, it is there in broccoli, it is there in spinach, it is there in egg. There are many other sources of calcium, right? So basically you have to use different combinations so that you get enough calcium. And unlike before, a few years back, there is a study saying that if you take too much calcium tablets, it can cause some heart problems. So we don't recommend a lot of calcium tablets these days. We want you to take at least 1000 to 1200 milligram of calcium totally from the diet and also from the tablet. So I usually give only one tablet to the women, and I say remaining you should get from your diet. Vitamin D, I told you earlier, very important for your muscles, for your bone, for your hair, for your memory, and many other things. Right? The best time to get vitamin D from sunlight is between 9 to 4 in India. And again, very few food stuff has natural vitamin D. You don't get vitamin D from drinking milk because milk comes from cow, which is always spending time inside the cow shed. It doesn't get sunlight nowadays, right? So again, it is there in the egg yolk only if the hen is under the sun, right? Vitamin D we cannot make our own. Fish, oily fish like sardines and mackerel, because they live in the superficial part of the ocean where they are exposed to sunlight, and also they eat a lot of algae. So that the oil is rich. The oil of these oily fishes are very rich in vitamin D and omega-3. And omega-3 is again because they are eating algae. So sea algae is another important source of omega-3 for vegetarians. Is it clear? Am I going very fast?
No, doctor. Good pace.
No, doctor.
Thank you. So treatment, again, hormone treatment is not for everybody. We choose some women for hormone replacement treatment because we cannot give hormone treatment if they have history of breast cancer, if they have family history of breast cancer, if they have history of endometrial cancer, if they have history of clots, etc., etc. We cannot give hormone replacement. If they are heavy smokers, we cannot give. And uncontrolled diabetes, uncontrolled hypertension, we cannot give hormone replacement. So otherwise, if a woman come to you right time after the menopause, we might give hormone replacement therapy up to around age of 60 years. Okay, so that is the maximum I have given. That is maximum most people give 60 years. I usually don't go beyond 55, in fact. And adequate nutrition with the right amount of protein intake is very important. I told you again, protein intake, how much? You should take at least 1 gram per kilogram per day of protein, right? If you're gaining muscle, if you're going to gym, you can take up to 1.5 gram. Exercise, walking alone is not enough. You need to do weight-bearing exercises at least 3 days a week, which you can do either in the gym or calisthenics. And you can always talk to your yoga teacher to include some weight-bearing exercise in your sessions, at least 3 times a week, which is very important. And there are some non-hormonal treatment for hot flushes. Some women come to you with severe hot flushes. Sometimes we give them hormone treatment. And if they are not suitable for hormone treatment, we give them non-hormonal treatment. There are multiple medications available these days. And of course, ensure adequate intake of calcium and vitamin D. Again, I must remind you one more time that the most of the bone is formed at the age of between 10 to around 33. So it's important to take adequate calcium and vitamin D at that age, which will make you having a better bone and will prevent a situation later on. I mean, prevent a fracture situation and osteoporosis later on. So always prevention is better than cure. So this is the age you must give enough calcium and vitamin D to your kids. Of course, if woman is found to have osteoporosis after the menopause, we treat for that. And we can always offer vaginal estrogen if there is a recurrent vaginal urinary tract infection. That the women can do themselves. We only teach them once. And easily available, they can apply themselves once or twice a week. And lubricants, of course, if there is dryness. And the adequate sleep, extremely important to have adequate sleep. At least 7 to 8 hours of sleep is very important. So you can see this, you can see this particular graph, the black mark is the hormone cortisol. Cortisol is the stress hormone. You can see around 4 o'clock in the morning, it starts to rise. That is the Brahma Muhurtam. We say that people wake up early morning, Maharshis, Rishis, and yoga people wake up. Basically, that is the time when your cortisol start to rise, right? Around 8 o'clock in the morning, it becomes maximum, but after sunset, it becomes very low. And by around 11 o'clock in the night, it becomes really, really bottom. You can see it around 11 o'clock in the night, it becomes really low. But if you stay awake after 10:30, 11, 12 o'clock, you are actually raising your cortisol. Having a high cortisol in the night, first of all, it will take away your sleep. Number two, it will increase your hunger. Number three, it will make you more fat. Just by staying awake in the night makes you fat without eating because your cortisol hormone is high, right? So that makes you gain weight. And next day you will wake up tired. So this is very important. Consistency is also important. Going to bed same time every day is very important. If you get sleep or no sleep, going to bed between 10 to 10:30 is extremely important, and wake up by 5:36. That's if possible. And again, one thing I must say that in India, everybody likes tube lights. Everywhere we like tube lights because it's very bright, right? The tube light has blue light which we cannot see. That light actually takes away our sleep. So after around 6, 7 o'clock, you can see the light of the sun. Evening setting sun is orange, right? That is the type of light what you should be using in the house. Warm white. Warm white is a light which you should be using in your house after sunset, right? So not bright light. Bright light takes away your sleep. Again, in your mobile phone, after evening, always use night mode. Always put on the blue filter. Blue filter on, and always you make sure that the night mode is on in your computer, in your mobile, in your laptop, everywhere. And at least 2 hours before going to bed, you must avoid self-emitting screens, self-light emitting screens, because that is going to take away your sleep, because that is preventing the hormone melatonin to come out from your brain. When you are exposed to complete darkness, you see that the melatonin hormone will come out, and that will make you sleep. That means complete darkness. You can see that the birds, naturally the birds go to trees to rest by 5:36 after sunset, and they don't make sound. They sleep, and morning around 3:34 they start chirping. But in cities, where you see a city like Bangalore or Kochi or wherever, where they use a lot of street lights, you can see the birds which is sitting in trees under the street light. Night full, they'll be chirping. You can hear this chirping of the birds in the night only in cities, not in the forest. Of course, there are some night birds that is different. I'm talking about common birds. So light management is important for sleep. And management of mind is very important. Your mind can be your biggest enemy, and it can be your greatest friend also, right? So basically, mind management is very important, and need careful tactics to manage mind. Yoga helps, pranayama helps. Pranayama, one good thing is that pranayama, when you do pranayama, there is a component of holding and long exhalation. Holding and long exhalation, or when you do Om chanting. Om chanting is you never inhale, you always exhale when you do Om chanting, right? So you do pranayama, you are actually activating your parasympathetic nervous system. Parasympathetic nervous system actually slows down your heart. You are activating a nerve called vagus nerve, which actually brings down your heart rate. When you do regular pranayama, because nowadays people wear Apple Watch, wearables, Aura Ring, and things like that, you can see your heart rate variability, or HRV, becomes much better. So since I'm doing pranayama, I know that I'm wearing this Aura Ring. I know before and after, my heart rate variability has nicely gone up. It's nicely improved. Meditation is extremely important, particularly in the night. And talking to supportive friends and family. Always spend time with, not only with your family, always have some good friends. For me, myself, I always have friends from school, not from college. School friends have no ego. We talk freely. When at the age of, now I'm 51. At the age of 51, I talk to my school friends. Basically, I go back to my 10-year, 12-year period, right? So basically that gives good memories. I always go yearly at least one trip with my school friends. Even if it is a short trip, I go with them. So short trips, vacation with good friends always helps. And take a mini mental vacation. Even if you're not going for a trip, basically 10 minutes of a day spend for yourself, not for your family, just for yourself. Take the mobile phone away, take the headphone away, just sit in one cool, calm place. And in the mind, you can do a vacation. In the mind, you can go to Kashmir. In the mind, you can go to Guruvayur. In the mind, you can go to many other places. right? So basically, you can do a mini vacation in your mind itself. So this is why I do a lot of trekking because I'm getting memories for my old age. When I cannot go, I sit quiet, 10 minutes, close my eyes, I think about the old tricks. Actually, that gives me happiness. And of course, limiting excessive exposure to distressing news. The social media is all about negativity and a lot of news channels bringing all the negativity. I think you should not really listen to all these things. You should stay away from people who talk a lot of negativity. There is always, Dr. Sujita always tells satsangam, spending time with good people. And, basically, having a good group of people, satsangam, doesn't mean that you always sing satsangam, bhajans, but you spend time with good people, which gives you positive attitude towards life. That helps a lot. So thank you. This is basically an overview, very simple overview. I'm not talking much about the medical aspects. I'm talking about in a layman's, this talk was prepared for general public, not for medical people. But I'm open to take some questions if you have any.
Yeah, if you have any questions, I think you can unmute you automatically and I can ask questions. I think Sheetal ma'am, you have asked some question. You can just unmute and ask.
Yeah, I'd asked if osteoarthritis also requires a DEXA scan, or is it only for
osteoarthritis and osteoporosis are totally different conditions. They are totally different. This is a degenerative disease, is osteoarthritis. Where osteoporosis is, imagine you are making a house, or you are having the concrete pillars, right? You are having concrete beams. In the beams, you have two things. One, you have the frame, which is the steel frame in that, and then you put metal with cement and metal. So osteoporosis is the condition when you are losing your metal and the cement. Your structure is there, but you're losing the metal and the cement. That is osteoporosis. Your bone is becoming weaker. Right. Osteoarthritis is totally different condition. Osteoarthritis, you don't need DEXA scan.
All right, thanks.
Any other questions?
Dr. Binu, this is Meenakshi here. I just want to check with you regarding my daughter, 28 years, and I'm working her and traveling period. It's quite in Bangalore, going to office for 2 hours, sitting in traveling, and coming back at 11:30, and she has us dinner by 7 o'clock. But the whole day, I think because of adequate sleep, and I'm just asking for you, like giving what are the nutrition part I have to taking care of. Already she is, but still I wanted to take care of that. She's very weak in that way, and her periods are normal. Sometimes only fluctuate, but now it is normal. So, what do you suggest for her? She's very weak in that way.
Okay, so basically, when we take a diet history and nutrition history, in India, we eat food for filling our stomach. That is the wrong concept. Food is not for filling our stomach. Food is basically for giving us nutrition. So when you plan the diet, we have three main things. What is carbohydrate, protein, and fat. Right. So then we have micros. Micros are vitamins and minerals.
Correct.
Yeah, that's micros, and macros are our carbohydrate, protein, and that should be in the same good ratio, right? So problem is that stomach, if you give a lot of protein in one single go, it cannot absorb a lot of protein. It will go wasted. It will just go wasted. So splitting is very important, and body cannot store a lot of protein. Like body store carbohydrate and fat, body cannot store a lot of protein, right? So if you don't give protein, body will take protein from your muscle. So it's important that if she doesn't actually have time in the morning, this is why nowadays people are using whey protein. Whey protein, at least a scoop of whey protein with some chia seeds, which you can put in the night and give it. Very simple. She can actually take it on the go. Very simple. But I'm not promoting whey protein, but I use it for a long time. India people have this habit of thinking that whey protein is not good. Actually, it is not true. Whey protein is completely okay, but should be good quality. Whey isolate protein, but not too much. 1 scoop a day is completely fine. So easily she get 25 gram of protein from that. Okay, and at least a small fruit. A small fruit is 15 gram of carbohydrate. She can, she can eat that in the and for fat she can take some nuts. 30 gram of nuts a day. 30 gram of nuts a day, basically. So there are ways. You can talk to a dietitian. They can formulate a way how she can do it. So make sure that she is taking at least 1 gram protein per day. Otherwise, she will end up in trouble later on if she is not, having adequate muscle mass. And
Yeah, she doesn't have adequate muscle mass.
that is very important. Adequate muscle mass is very important. So
Right.
again, you must understand that doctors are not trained dietitians. We give diet advice, but we are not the best people to talk about diet. The best people to talk about diet is a certified dietitian or a nutritionist.
Correct, correct.
So everybody's situation is different. So we can only say general advice, but it's always better you talk to a dietitian if possible, so that they are, because the diet patterns are different. So there is always way. There is always way. One good thing is that many people do the mistake of taking too much protein in one go, thinking that yes, no, body is going to waste it. Body is not going to absorb so much of protein in one go. That will also cause bloating. You have to divide. Taking adequate fiber is very important as well. Fiber means people always think about eating vegetables, especially cucumber. All these things people think it's fiber. Cucumber has no fiber. It is mostly water.
Water,
Right?
yes.
Yeah. So fiber is there in pulses. Your moong dal, your soya bean, all the pulses, a lot of fiber. A lot of fiber in potato, a lot of fiber in sweet potato, a lot of fiber in basically some fruits, particularly your what do you call passion fruit and things like that. A lot of fiber. Peach, plums, they have fiber, and also fiber is there in guava. Not many fruits also have enough fiber. Chia seeds, very good source of fiber. At least 25 gram of fiber per day you must take.
Okay.
Because why it's important is because in our large intestine there is millions of bacteria, good bacteria live. That is called probiotic bacteria.
Okay. Okay.
They need fiber.
Yeah, and one more is her sleeping cycle is different. It's very late night by the time he reaches office from the it is 11 o'clock, 11:30 is like that, and
Yeah.
then settle down. So I think that I made her to watch. You are talking about the cortisol level. I just because when we say, and then when I told her to sit and watch this first, and then make a timetable for herself, what at any cost I was
Yes.
telling her. Thank
So
you so much.
we see a lot of girls with polycystic ovary syndrome and all these things, acne, hirsutism, and sleep is the main problem in them. And weight loss, obesity treatment. We see a lot of people with obesity. Unless and until you sleep well, you are not going to lose weight, even if you're taking medications.
Thank you very much, doctor. Thank you.
Thank you.